Hi, I'm Heather Hunley with Look Up Indiana, and joining me today is the Honorable Charles Pratt. Judge Pratt serves in the Family Relations Division of the Allen Superior Court, and he has been instrumental in multiple court practice reforms in child abuse and neglect cases, many which have been replicated by juvenile courts across the state. In 1990, he founded the annual Conference on Youth to provide training on positive youth development and strength-based practices for child and family professionals in northeastern Indiana. And in 1999, Judge Pratt established Allen County's Positive Youth Development Initiative, Great Kids Make Great Communities. Great Kids provides ongoing training and research on a variety of issues related to children and families. And I could go on.
That's fine.
There's a long list, but we'd like to take a little time today to get some training and education and insight ourselves. So, Judge, first of all, thank you for joining us
Thanks
today.
for having me.
So, there's been a lot of buzz lately around the word trauma.
Right.
And for those of us who may be unfamiliar with what that means, how could you educate us a little bit?
I think it's a concept that those of us that have been working in the field of juvenile justice and many of the agencies with whom we contract as a court and through the Department of Child Services have recognized as an impact on the lives of children and families. Going back to our original founding as Great Kids Make Great Communities, we worked on the whole issue of developmental assets out of the Search Institute. And the Search Institute talks in terms of the building blocks that children need to grow into healthy and productive adults. And many of those include all sorts of factors, including a strong support system of adults that are guiding them, commitment to education and understanding of empathy, and a whole packet of kinds of elements that a child needs to become resilient. And resilient is really the antidote to trauma. And so as a court, we've always been interested in understanding why certain people engage in certain behaviors. Why do they respond in a certain way to the situations that life may throw at them? And why do they respond in a certain way to the court services? So that led to a lot of research on evidence-based practices, and it led to us changing the way we do court in a way to minimize the impact. So it's not an adversarial process for child abuse and neglect cases, but rather a conversational approach to addressing the needs of families. And that's designed so that we're not further impacting or using a medical concept, doing more harm in trying to achieve the cure. Great Kids was founded, as you mentioned, several years ago with the idea of looking at these positive youth development practices. And our principal funder has been Follinger Foundation throughout that because they have captured that same vision, and they help us with our annual conference on youth that I'll mention in a minute. But there's been some really significant research out of the Center for Disease Control and Dr. Robert Anda, who is a principal investigator, as he would characterize himself. That's been around for several years, but it's really capturing the imaginations and the ideas across sectors, because it was originally a medical model on understanding disease. And what they discovered was that adverse childhood experiences, or ACEs, are circumstances that are experienced during the age of development of a child that last and carry through in that child's life. And unless properly addressed, a high ACE score, a high number of experienced trauma, can result in direct connection to heart disease, cancer, and in an extreme form can reduce a child's life by as much as 20 years. So it's a significant medical outcome. And as other sectors, including juvenile justice and education, have started to examine this research, we realize that they are impacting the way behavioral issues are manifested in those different sectors. That is to say, a high ACE score or even a moderate ACE score can cause a child to respond negatively behaviorally within a school. So although we're not trying to minimize or go into a victim stance where no one is held responsible, that's not at all what this means. But understanding that this child has experienced trauma and is responding to that trauma gives you a set of tools now by which to address that child's behavior in a productive way that can adjust that child in terms of his behavioral choices in the future, as well as starting to resolve his long-term health issues. And we need to do the same thing in the court. So what we've been trying to do is explain to the entire community, and this has got a statewide movement and element to it. The Juvenile Justice Improvement Committee and others with the across the state in St. Joseph County and Marion County and Lafayette are all looking at how do we apply ACEs in a universal way across sectors, and with the court buying into it, particularly the juvenile court, taking measures to making sure that families are connected to services that help address those ACEs. And trauma events can include something as what is considered today's culture as relatively benign, a divorce.
Right.
It is a traumatic event for a child. Mm-hmm. And that traumatic event, unless it's properly addressed, carries through. And so it's real important that we start getting the word out. I'm rambling a bit, but I see so many families that are fighting in divorce matters, and all they're doing is enhancing and creating greater traumatic impact on their children. Yes. And so they're not serving their children in any meaningful way by not being able to resolve their differences. And there are mechanisms available for them to resolve differences through alternative dispute resolution, for example, in a divorce, where they work with a mediator to try to resolve these things so that there is less contentiousness between them. And there are good programs out there as well that we are contracting with or providing in our child abuse and neglect cases.
So you mentioned this ACEs, the adverse childhood effect. We will post the link. There's actually an assessment. I've taken it myself. It's very enlightening.
Right.
Kind of explains a few things.
Yeah.
We will post that on our website along with this interview so that you can kind of see what that is and take that further if you would like. So thank you for sharing that.
Sure.
So you mentioned divorce and some of the negative effects that has on children when the parents are reconciling their differences amicably. What other effects of trauma are you seeing?
Well, certainly in my court, since I do child abuse and neglect, we're seeing kids that are exposed to extreme domestic violence. And domestic violence is largely misunderstood in many instances. It's more than two parents fighting. There's this idea that, well, if Johnny's in bed and in his bedroom with the door closed and they're fighting and arguing and there's screaming going on in the living room or outside on the front porch, that somehow there's no impact. And there's plenty of research that demonstrates that the child trying to fall asleep in his bedroom, hearing the fight going on between the mother and the father, is traumatic to that child, even at a very tender age. So domestic violence is not just the situation where a dad slugs the mother or vice versa, but it's even these loud arguments that really have that explode into irrational behaviors, storming out of the house and yelling obscenities and stomping around. Those kinds of violent exposures to a small child that's not able to process that is trauma. And so that builds the ACE score, the adverse childhood experience, onto other things. There's also the physical trauma. Even the death of a close relative can be an adverse childhood experience. So not every ACE score is tied necessarily to behaviors that are controllable. They're outside our experience. The hurricane in Texas, the hurricane in Florida are all trauma events. And we know that we have to come in and we have to help people process that information in a healthy way. And so the trauma response is really, how do we build resilience? How do we demonstrate that there is a safe place that the child can go? That, quite frankly, a lot of the research on building resilience includes an understanding of spirituality, that God is there, that there is a bigger purpose in my life than just me, and that there's a protective God that they can go to and that they can find solace in. And then also as adults, it's our job to create a sense of safety. To allow safe places for children to go, to be the adult that takes on, quote unquote, the terror of the nights, so that child can be a child. And those are some of the responses. And so the key is to connecting when these children and adults are exposed to traumatic events, to the right kind of people that can help walk them through with the kind of care that they need to build back that resilience. And we have a number of agencies, good agencies, that do that in Fort Wayne. For example, Lutheran Social Services has some programs that are deeply embedded in understanding trauma response, and Mental Health America is another great link for getting connected to the right kind of people. And Park Center also. And I'm not here to do advertisements, but these are some of the people that I know that I have gone to and asked questions of in terms of understanding trauma. Particularly Lutheran Social Services and Park Center have both been, I think, demonstrating some real leadership in this field.
Great. And speaking of that, we will post links to that as well so that you can check out those resources and get further educated on trauma and what they might be able to offer as well. What kind of, so you mentioned those organizations, but talk a little more about the programs and initiatives that you're involved with and with the court. I know there's a conference coming up.
There's a great conference. Thanks for that. We're having our annual conference on youth. Great Kids, its principal responsibility is training adults. Great Kids Make Great Community is a positive youth development initiative, but it's not doing services with children. Rather, our mission is to provide evidence-based practices, training, and research on what is the best way to address the needs of families and children. So Great Kids has a mental health training series that the Lutheran Foundation funds, and that's a regular recurring event over the course of the year where we provide specific trainings on specific topics dealing with mental health. And then through the Follinger Foundation, we do other trainings, particularly our annual conference on youth. And this one is on October the 5th. I had to check my notes.
Yeah. It's on our website as well.
And the annual conference on youth is a gathering at the Memorial Coliseum. It's usually the first Thursday of every year, of October every year. And the idea is to bring in a national conference, what you would not have unless you went someplace else, and to make sure it's affordable and for people that are working really in the trenches, and people in the faith community, people in the education community, people in juvenile justice, people in law enforcement, across all professional sectors. To bring them all together and to hear and receive training by well nationally recognized authors and researchers. This year we have Dr. Anda, whom I mentioned on ACEs. We're also having Laura Porter, who's also part of the ACE Interface organization that brings training. We're also bringing in some people from the Lutheran Church Missouri Synod who have opened up a new recovery facility and housing, and it's a new center in Ferguson in response to their horrors that Ferguson experienced.
Wow.
And they're going to be talking to us about how to do asset building mapping within our neighborhoods, and also how we as a community can come together as a unified force to walk together as we all face the challenges of life. And so we're real excited. The whole conference is really focusing on trauma and trauma response and resiliency. And I think there's something for everybody, and it's a very minimal cost. I think it's $40, and that includes all of the materials, a lunch, and the whole 9 yards, and it's all day long. But I think it's important for people to send representatives from their congregations or from their organizations to attend this conference, because we don't receive anything as a court out of this other than a better informed community. And the more we are professionally skilled to respond to these needs of the children and families, the better our community is in terms of safety and health and all that goes with that.
Absolutely. I've attended a few times in the past, even before kind of the role with Lookup, and found it very informative and helpful personally, professionally, and as a mom.
That's good to hear.
Just as a parent.
Yeah, even a parent could come, because we always have various programs for parenting and faith building as well.
Absolutely.
Yeah.
Yes. Well, I know we could go on and on, so we might have you back.
That'd be great.
A wealth
Anytime.
of information, but I'm not sure if you're a T-shirt guy. We always do a T-shirt, Lookup T-shirt. It has our logo, "Start the Conversation, Silence the Stigma" on the back.
Right.
Is there anything else you wanted to share with us?
No, I'm just really thrilled at what the Lutheran Foundation is doing and bringing awareness in terms of mental health is significant. The vast majority of the people that I see have mental health issues, and I see quite often a lot of shame, and there's a lot of work to do. I have cases where it's when you sink into that, it's very difficult to understand how to access services and how to connect with them in an easy way. And so the more we can do to spread the message of who's out there, and we have an enormously our community is just a really great community in terms of resources. It's really helping the people connect with those resources. That's the challenge.
Absolutely, and that's what we're working on
I know.
every day.
Yeah. So thank you for doing that.
Thank you.